Hi, good evening. My name is Hisham Baalbaki. I'm a cardiologist, and I've been asked to go over with you a very interesting association between the use of oral contraceptives and smoking on the one hand, and the increased risk of cardiovascular events, namely strokes, heart attacks, and pulmonary emboli. So this association of either the use of oral contraceptives or smoking with these serious events in young women was described approximately 30 years ago and went unexplained for some time. As you know, a statistical association doesn't essentially mean that there's a causal association. Nevertheless, these observations were repeatedly seen and especially noted in women taking oral contraceptives and or smoking if they had other risk factors for heart disease, which certainly made sense. These risk factors are high blood pressure, high cholesterol, diabetes, obesity, sedentary lifestyle, as well as some genetic predisposition to these events. So those repeated observations raise the question, what is this? How can we explain this? Uh, Unfortunately, it wasn't until recently that we started figuring out the pathophysiology of the association. Meanwhile, they were trying to find out if there's any correlation between the dose of oral contraceptives, the kinds of oral contraceptives. As you know, there are various kinds of oral contraceptives that have been developed over the years, the first generation, second generation, third generation. And even though they haven't been compared head to head, there seems to be improvement in the risk of stroke. Nevertheless, that risk continues to occur, especially in women that have other risk factors for heart disease. So, to understand whether this statistical association is for real, we need to understand what is the pathophysiology of most heart attacks, strokes, and pulmonary emboli. And the bottom line that's common between all these events is the formation of a blood clot. In the case of a heart attack, the blood clot occurs inside a small artery that typically is 3-4 millimeters on the inside. There's injury to the wall of the artery. Part of the healing process is a formation of a small blood clot. Now, if it happens that that individual forms more blood clots than usual, and the blood clot completely blocks the artery, then that ends up being a heart attack, which is essentially a cessation of blood flow and nutrients to the heart muscle for 10 to 15 minutes. In the case of a stroke, the brain is much more sensitive to lack of oxygen and nutrients, and that doesn't have to take that long. Typically, the thrombus forms in the neck and goes to the brain, blocks an artery of its size, cuts off the blood supply to that particular area, and depending on which area of the brain, the clinical syndrome of that stroke is noted. In the case of pulmonary emboli, we're talking about formation of blood clots on the venous side. And typically those blood clots are either in the pelvic veins or in the veins of the legs. And if that blood clot tends to, for some reason, leaves those veins and goes with the normal blood flow to the lung, then if once that pulmonary artery is blocked with that blood clot, and if the blood clot is a big blood clot, then a certain part of the lung is not getting oxygen, so the level of oxygen goes down, and the heart now has to pump into the lungs, and it's under considerable stress because it's not used to that kind of obstruction to blood flow. So the pathophysiology of both heart attacks, strokes, and blood clots is thrombus formation. So let's go back and see how can we explain this association between smoking on the one hand, the use of oral contraceptives on the other hand, with increased risk of blood clots. Well, in the case of smoking, nicotine causes injury to the arterial wall and to the venous wall. And as we said, part of the response is a formation of thrombus at the site of injury. Well, in the case of smoking, there's increased thrombus formation because the ability of the body to dissolve the thrombus is reduced. The body is in a constant state of forming blood clots and dissolving blood clots. And in situation where there's bleeding, the ability of the body to form blood clots increases. In patients that smoke, the ability to dissolve those blood clots is reduced. So the load of thrombus, the volume of thrombus tends to be bigger, and depending on where it is, if it's in the heart, coronary arteries, it may cause a heart attack. In the brain, it may cause a stroke. In the veins of the legs, it may cause a pulmonary embolus. When it comes to the use of oral contraceptives increase the risk of thrombus formation because hormones induce the body to form more of the elements of the proteins in the blood that promote the formation of thrombus. And so while the use of oral contraceptives by itself does not initiate a injury to the wall, if there is any injury for whatever reason, there is increased volume of thrombus because the body tends to form more blood clots in that situation. And again, the syndrome of strokes and heart attacks and blood clots to the lungs. So in a person that smokes and takes oral contraceptives, you've got a double whammy. You've got the oral contraceptives increasing the formation of thrombus, and nicotine use decreasing the ability of the body to dissolve this thrombus. And so that's why these observations in terms of the pathophysiology can explain what we see clinically in terms of increased cardiovascular events in ladies that smoke, use oral contraceptives, or do both. So I hope this was helpful, and thank you very much.